Today in this video, we will learn about tuberculosis. Tuberculosis is highly contagious bacterial infection which is caused by Mycobacterium tuberculosis. It primarily affects the lung but can also affect the other parts of the body such as the kidney, spine and brain. TB has been a major global health concern for centuries, and despite of significant progress in its control, it remains a significant cause of morbidity and mortality worldwide. This video will provide a detailed overview of tuberculosis, including its causes, symptoms, diagnosis, treatment, and preventive strategies. Tuberculosis is primarily transmitted through the air when an infected person sneezes, speaks, or releases droplets containing the bacteria into the environment. Factors that increase the risk of contracting tuberculosis include the close contact with an infected individual living in the crowded or the poorly ventilated area, having a weakened immune system in the HIV and AIDS, malnutrition. The symptoms of tuberculosis vary depending on the site of the infection. Pulmonary tuberculosis, which will affect the lung, is one of the most commonest forms of tuberculosis. The typical symptoms include persistent cough, often with a bloody sputum, chest pain, fatigue, weight loss, night sweats, fear. In extrapulmonary tuberculosis, symptoms depend on the affected area, such as the back pain for spinal tuberculosis or the blood in the urine for the renal tuberculosis. Diagnosing the tuberculosis involves a combination of medical history, physical examination, tuberculin skin test, interferon gamma release assay, chest X-ray, and the sputum test. The TST and IGRS help to determine whether a person has been exposed to TB bacteria, while chest X-ray and the sputum test aid in confirming the active tuberculosis infection. Treatment of TB is treatable and curable with a combination of the antibiotics. The standard treatment for active tuberculosis consists of the initial phase, usually 2 months, with the 4 drugs, isoniazid, rifampicin, pyrazinamide, and ethambutol, followed by a continuation phase, usually 4 to 6 months, with 2 drugs, isoniazid and rifampicin. Adhering to the prescribed treatment regimen for the entire duration is crucial to ensure the complete eradication of the bacteria and prevent the development of the drug-resistant strains. Prevention. Prevention of tuberculosis involves a multifaceted approach. Key strategies include: first, vaccination. The Bacillus calmette-guerin vaccine offers some protection against the severe forms of childhood TB but has variable efficacy against the adulthood TB. Second, infection control helps to prevent the transmission of TB, promoting the good ventilation, ensuring the adequate sunlight, maintaining the proper hygiene. Third, early detection and the treatment. Prompt identification, diagnosis, and the treatment of the active TB cases can prevent the further transmission. Fourth, contact tracing. Identifying and screening the individuals who have the close contact with TB patients enable the early detection and the treatment of the latent TB. Fifth, preventive therapy. People with a latent TB infection, especially those with a higher risk of developing active disease, may benefit from preventive antibiotic therapy to reduce the risk of progression. Conclusion: tuberculosis remains a significant global health challenge, particularly in the regions with the limited resources and the high prevalence rates. Early diagnosis, effective treatment, and prevention strategies are crucial in the curbing the spread of TB and reducing its impact. Continued efforts are needed to develop new tools, improve access to healthcare, and address the social determinants to eliminate tuberculosis as a public health